My today's topic is anemia in children and teens, and this is my Facebook and Instagram handles. If you like my content and you think that this is very useful, so please subscribe my channel and also follow me on Facebook and Instagram too for the more updates. Next, the anemia in children and teens. I think that this topic should be discussed so the parents know that what are the normal limits, and if the baby or the children are suffering from anemia, they must be treated at home first. If it is at a mild level or like they are moderate level, and so it can save them from a severe or kind of a disease or disorder, and if they find out that they having a mild one, so it can be treated through the diet or with the iron supplements. Anemia is basically a condition in which your body is like lacking rbcs or having a low or below normal levels of rbcs in the body, and because of this, uh, like you are having an anemia or your body is not having a proper iron in your body, and that causes a child to look pale, tired or weak. Now I will tell you that what are the few normal levels so you can compare your child's level with this one, and you can know that either he's or she is having mild, moderate or severe kind of thing. And if you find that it's a moderate or severe type, then obviously you should go to your pediatrician, your baby's pediatrician, and talk to him, and he will give you the medicines or supplements or a proper diet also. But I will share a few diet also that what you can add in your baby's food to make it more iron rich. Okay, next I will tell you that what are the risk factor or when he or she can become anemic. So there are like three conditions. Number one, when they are having the low iron level, just because they are not taking too much iron in their diet, so nutritionally they are lacking iron, that cause uh, low grow or low levels of rbcs, like not more rbcs are forming because of lacking of iron in their diet. Next is your rbcs are destroying and at a higher rate just because of some kind of disorder such as sickle cell anemia. And the third one is there is a lot of loss of blood from your body, maybe due to heavy menstrual flow or long term blood loss in the stool. If these two conditions are present, that cause really a lot of loss of your red blood cells with the blood from your body. Now next I will tell you that what are the sign and symptoms. So the sign and symptoms are they must be having a pale skin, or their pale cheeks and lips, their eyelids, they are having a dark under their eye circles, or they are showing a tantrum, slow growth, or poor immunity, and they feel tired and they are taking more naps, and they might having a jaundice, or they are passing dark colored urine, and their eyelids, nail bed look like less pink, or they are not like a normal pink. Okay, there is another important sign which is known as pica. In this, your child is eating some non-foods that are not for eating purpose, such as ice, dirt. Very when your child having a very levels of low levels, that's why hemoglobin, they are eating these things: dirt, ice, clay, paper, cardboard, or even cornstarch. And these by eating these things, they can cause there's a constipation, and your this if this sign is present, that it shows that you should immediately go to the pediatrician and ask them about it. Next, I'm telling you that what are nutritional anemia and how you can prevent it. So, if I am talking about initially, like from your infant age, so don't give your baby cow's milk until he or she is like over 12 month old, because if you start giving them it will cause blood loss in stool, and that would decrease the iron absorption in the gut also. Okay, so the two things: if your child is breastfeeding, he is receiving iron from that milk until the age of 4 to 6 months. After that, he should take the complementary foods that are rich in iron, or their pediatrician, or you can discuss with the pediatrician to give the iron supplements. And if they are formula feed babies, then they you should choose the formula which is high which contain high amounts of iron. If low iron is present in the milk, then that it may cause anemia. Okay, so after 12 months, not more than 2 cups of blood should be or milk should be given to the baby, because if they will feed more milk, their stomach is full, and they won't eat food that may cause anemia. And the next is, feed your older children's balanced diet with the foods that contain iron, like iron rich foods, and encourage them to eat, or family with the family eat more fruit that contain antioxidants or vitamin C for the better absorption of iron. Now, next is, how much iron do you need? So, how much iron an infant need is 11 mg per day. Kids needs around 1 to 8, like 7 to 10, and 8 mg per day required from age 9 to 13, and for like 15 to 18 mg females. Pregnant ladies require 27 mg per day, and 8 to 11 mg per day male required. That's why during pregnancy, doctors prescribe iron medicines to the pregnant ladies, because their requirement for iron is too high, like 27 mg per day. That not. Next, I'm showing you the iron rich food for babies. Um, Scrambled egg, sweet potato, peas, oatmeal, tofu, meat, beans, and chickpeas. Chicken, you can, and chickpeas also, because you can make something from these. Like when you start for them to eat start solids, they include these things in their diet, and through this they can take the required amount of the iron from food, and you won't require iron supplements then. 10 best iron rich food for kids, like when they reach the toddler become, or the kids at that level, you can give them these things, and they are fully highly rich, or you can say high in iron: broccoli, leafy green vegetable, eggs, cereals, or dry fruits, fish, red meat, and nuts. Now next, how you know that which fruit is giving you how much amount of iron. So these are like measured amount that this give you about this mg or this milligrams of iron. So you can easily follow this, and know that how much you are giving this to your baby. Okay, this will make it easy for you. Next, I'm sharing like two recipes. One is green smoothie. In this, you will need half cup milk, your favorite milk, or almond milk. You can say half sliced banana, 3 to 4 strawberries, mango chunks, or here 3 to 4 mango chunks, and apricot, also a half apricot. You can say 1/4 cup spinach, and blend them all. And if they don't like in smoothie form, you can make a popsicle from it, freeze it, and then give it to them, and I hope they will like it. Next is banana spinach muffin. So for that you need all these ingredients. Just mix them and bake it as you bake for the muffins normally, and this is okay for them, and they will like it.